This begins meeting number 3 of the deposition of Joseph Bianco, T.O., on the record at 1:05 p.m.
Doctor, you ready to continue?
Yes, sir.
Okay, I want to show you Exhibit 9. And I represent to you that those are, excuse me, this is what's been produced to us as the call details for Dr. Hamilton's phone number on the 26th, 27th, and 28th of June, actually through 30th of June. And my question to you is, you see there's a column that says phone number.
Yeah. Yes, sir.
Do you recognize any number within that column that belongs to you?
No, sir, I do not.
And I want to draw your attention, there's some numbers on the very first page, along the far left column. You see those? It's like the very last one is 313. The top of the column is 269. You see those numbers?
Yes, sir.
I'd like to draw your attention to the number 302 on that chart. And Dr. Hamilton testified earlier this week that 302 entry represents a call from Dr. Sade regarding Mrs. Mejia.
Okay.
If you start at that point, I want to ask you if you could take one more look at this. You see how there's the date 6/27. It's the column immediately over from the 302. I just want you to go through from that 302 point and double check for me to make sure that we're not seeing a phone call to you on the 27th on this number. So if you look at the first page, just confirm for me going down 302, 303 through the rest of them. And let me know when you've gotten to the bottom. Have you looked at that first page?
Yes, I didn't see anything, sir.
Okay, then start, excuse me, on the second page. And the numbers on the left again, 314 through 324, reflect calls associated with the 27th of June. Are any of those your number?
As far as I can tell, I don't see either my home, my office, or my cell phone.
Okay. And there are two entries, 319 and 320, that indicate that the phone number is unavailable. Do you see that?
Yes, sir.
Have you ever had your number blocked or made, either your home, your office, or any other number you used at the time, blocked or made unlisted where it would not show up?
Sir, I cannot think of anything where that would happen.
Okay. Thank you, sir. Now, we talked to Dr. Hamilton earlier this week, and she told us that immediately after forget the date she said, but shortly after Mrs. Mejia died, that Dr. Sade had reported her to the medical board and sought to revoke her privileges and credentials like you had been revoked at University General. Were you ever made aware of that?
No, sir.
Okay. Were you ever asked, outside of any kind of peer review committee related discussion, were you ever asked anything by someone who represented to you that they were involved in some action to either revoke Dr. Hamilton's privileges or restore them or modify them in any way?
No, sir.
Dr. Hamilton on Monday expressed concerns to us under oath that she had with the hospital, and one of those concerns she told us about was that she felt that University General Hospital's nursing staff was not able to handle complex patients. She also testified that that was a concern that a number of other doctors had expressed to her. Did you ever have those types of concerns yourself?
No, sir.
Did you ever hear Dr. Hamilton express any concerns like that while you interacted with her?
No, sir.
Dr. Hamilton testified on Monday that she was concerned that, excuse me, post-lunch, and I apologize. On Monday,
It's not getting better, is it?
I don't smoke, so I don't know what it is. On Monday, Dr. Hamilton testified that, in her opinion, University General Hospital Dallas was not equipped to handle a patient like Mrs. Mejia if she continued bleeding because they lacked an interventional radiologist. Just represent to you, that's what she said. Did she ever express any of those types of concerns to you while you worked with her?
No, sir. I've never worked with her.
Okay. Had you ever heard any doctors at UGH express any similar concern?
I've listened to people complain, but the situation is that I can't think, outside of cardiology that had to be transferred, University General's handled everything, and to me, done a good job over the years, whether it be Renaissance or University General or whatever.
So, am I correct then that you did not have a concern that the hospital lacked appropriate interventional radiologists to handle a patient like Mrs. Mejia?
Objection form.
You're correct. I thought the hospital could handle that.
Now, on Monday, Dr. Hamilton testified that she had concerns that the hospital did not have enough blood if Mrs. Mejia continued to have problems bleeding. Did you ever have a similar concern about University General Hospital?
No, sir. We carried 2 units of O negative, and we've always been able to get blood from Carter. Type and cross match.
Now, we've talked about Dr. Hamilton, we've talked about Dr. Cotta. Were there any other doctors, for example, Dr. Kopman, that you spoke with about Mrs. Mejia after receiving the call from Dr. Shada about your privileges being revoked?
No, sir.
In other words, did any of the doctors that you had talked with about her previously call to ask any questions or call to inquire about any of your course of treatment?
No, sir.
At the time Dr. Shada called you around, I think you said it was around 4 that day,
4:30.
did he indicate to you what Mrs. Mejia's condition was at the time?
No, sir.
Did he ever relate to you anything that led you to conclude she was having any problems or any complications at the time he made the call?
No, sir.
What was your understanding at the time he made the call of her condition?
I thought she was recovering, and I thought she was improving.
And what was that based on?
What's
What
her-
was that based on?
Her hemoglobins and hematocrits, the drainage from the JP drain, the fact that she was responding to questioning in the ICU.
At that point in time, when you had that call from Dr. Sade, and when you had between that point, rather, and when you called, strike all that, between the point in time when you had that conversation with Dr. Sade and had that impression about Mrs. Mejia, and when you received the call from Dr. Hamilton and discussed her with Dr. Hamilton, did you have any belief that Mrs. Mejia's condition was serious, deteriorating, or required any emergency type intervention?
I felt her condition to be serious / critical, but I thought that she was going to recover, and I thought I expressed that to Dr. Hamilton.
Based on that belief, can you offer any explanation why a doctor might refuse to assume the attending physician responsibility for a patient in that condition?
Objection.
Sir, that is each and every doctor's responsibility, or I guess choice, but that's it. I can't speak for others. I was never trained that way.
And what do you mean by that?
Non-responsive.
By that, I was never taught to refuse. I was never taught to turn my back. That's all I can say for me. That's it. I've never had that.
Why do you feel you were taught that?
Objection form.
When I trained in Chicago, that was not something that you did.
I want to try to play something for you here. Let's see if I can make this work.
This is Chuck, calling for Dr. Hamilton, who is on call at University General Hospital System Dallas. I am the chief of staff there. We have a surgical emergency. She is needed immediately. Please call 972-974-5697 or come to the emergency room immediately. Again, call 972-974-5697. Come to the emergency room immediately. This is an emergency. Thank you.
First off, could you hear that okay, or should I
I
play it
thought
again?
I heard, who was calling?
I think it's Dr. Shad. I was going to ask you, I'll play it again.
This is Chuck, calling for Dr. Hamilton, who is on call at University General Hospital System Dallas. I am the chief of staff there. We have a surgical emergency. She is needed immediately. Please call 972-974-5697 or come to the emergency room immediately. Again, call 972-974-5697 or come to the emergency room immediately. This is an emergency. Thank you.
When was that call made?
That's what we've been trying to figure out. Do you remember Dr. Shade? I keep saying the name differently.
Shada.
Shada. Do you remember Dr. Shada ever classifying Mrs. Mejia's condition as being an emergency?
Not while I was in charge of the case.
If you'd received a call like that, what would you do to respond to a call like that?
Call,
Yes.
jump in the shower, jump out, get in the car, and be there as soon as I could.
When Dr. Shad uses the term immediately, what does that mean to you if you were receiving a call like that?
That's scary if it was my patient.
Why do you feel that way?
They're calling me, and it's a problem, and you'd better get there.
Now, I want to show you Exhibit 2. I think we've talked about the original procedure. I want to talk a little bit about the second procedure that you did with Mrs. Mejia. And is this Exhibit 2 the operative report you did for the procedure to correct the bleed? Is that what you have in front of you?
Yes, sir.
Okay. Again, no one assisted you with that like Dr. Silver did at the beginning, correct?
That's correct.
Do you recall drafting this or dictating this operative report?
I don't remember the exact time, but I know that I did it.
Well, if you'd look on the second page, I wanted to see if you could help me interpret some of the markings at the very bottom near your signature. First off, is that your signature at the bottom?
Yes, sir.
Okay. So below that, there's a number of little entries, and I want to draw your attention to the D:6/27/2014, 3:13 p.m. entry. Do you see that?
Yes, sir.
Does that reflect that you dictated this note at 3:13 p.m. on the 27th?
Yes, sir.
Is that your recollection of when you did it?
If it's down there, then I must have done it. Do I remember? No, sir, I do not.
Do the string of numbers and letters to the left of the D: entry mean anything to you?
No.
The next one over to the right, the T, I've seen referred to as transcribed. Is that what you understand this
Yes,
to be?
sir.
Who was doing your dictation transcription back in June of 2014?
Medical records.
When you say medical records, is that at the hospital?
You know, what happened was that they farmed it out to a transcription company. I don't know what their name was. And I don't even know where it was located. It could have been located in Florida.
Okay.
But I cannot tell you, sir.
Do you recall, so the procedure itself had been done earlier that day, correct?
Yes, sir.
Do you remember what time?
Yes, sir. We went to surgery at 5:30 a.m. and basically completed about 7:30 a.m.
After you completed, do you remember the surgery, what did you do?
Well, I wrote the post-operative note. I wrote the orders. Went over to intensive care. I saw Jay right there and asked him to take care or take a look at Miss Mejia. A short time later, I called Dr. Kottman and asked him to consult and medically manage.
Remember anything else you did that day? After the 7:30?
Yeah, I went to my office and pretty much worked in the office. I saw Miss Mejia twice in the afternoon. I was there when Dr. Kottman was there and spoke to the family. I went back a little bit later and saw her so that I could go home.
When was the last time you saw her?
Somewhere around, if I'm not mistaken, 3:30, 3:45.
If the dictation note indicates that it was dictated around 3:13 p.m., would that have been before or after you last saw her?
I can't tell you that, sir.
Okay. Do you recall any conversations with any of her family members on the 27th?
After surgery, I spoke to her mom and dad. I met her husband for the first time, and I think I met a brother.
Do you remember anything those individuals said?
Sir, I do not.
With respect to her father, you've told me that he said something to you about a fall that she sustained hitting the toilet.
Yes, sir.
Do you remember anything more specific about what he said?
No, sir.
Did you develop any opinion as to why she was falling?
No, sir.
Did he describe to you, did her father, Ms. Mejia's father, describe to you any episodes of faintness or other dizziness or any other condition that would cause her to fall?
What he said was that she called him stating she had tried to get the nurses and was getting up, going to go to the bathroom on her own. And he didn't say any more than that to me.
Did he describe to you what part of her body was injured, if any, in the fall?
No, sir.
Did anyone relate to you that Mrs. Mejia said that a particular part of her body hit any particular thing in the fall?
No, sir.
Do you recall Mrs. Mejia complaining about any particular area of pain or injury associated with the fall?
Not associated with the fall. She had pain in the upper right quadrant.
Did you talk with any other care providers at that time who related to you anything the family or Mrs. Mejia said about this fall?
Not that I remember, sir.
Okay. Now, going back to the operative report for the second procedure, I want to ask you a couple of things. Second paragraph says on laparotomy, you see that?
Yes.
And within that, the second sentence says we were able to remove the clots.
Right.
When you use the term we, to whom were you referring?
I had a first assistant who was one of the nurses, and we suctioned the clot out of the space between the liver and the transverse colon.
So who is the assistant?
Can't remember to tell you, sir. I just don't remember.
But it was a nurse?
Yes, sir.
Where did you obtain the nurse to assist you?
She was in the operating room.
Was she an OR nurse?
I believe she was, sir.
I'm assuming it was a female since we're saying she.
Yeah, well, hopefully. Yes,
And,
sir.
I guess in this day and age. Do you recall what race this nurse was?
Yes, I believe she was a black lady.
Do you know anything about what you don't recall her name, correct?
I think her first name was Deborah. I've scrubbed with her before, and I think she's excellent.
And how is it she came to be involved in assisting you in the procedure?
She was called in as part of the crew,
Okay.
and she had scrubbed with me before and just stepped right in.
So when you're using the term "we" throughout this operative report, was it your intent to refer to yourself and this nurse, Deborah?
Yes, sir.
Okay. Were there any other doctors involved in performing the steps that we're reading about in this operative report?
No, sir.
Now, in that second sentence in the second paragraph, it talks about ligate a small vessel coming off the right hepatic. What are you referencing there? What does that mean you did?
It was a small artery coming off the right hepatic.
And what is it you're describing that you did there?
Well, we put an instrument on the bleeder, put a tie around it.
Can you recall what the bleed looked like?
Are you referring to, was it a heavy bleed or was it a small bleed or?
Let me back up. The hepatic artery, can you recall for me any better the condition of the artery with respect to the bleed? Was it a tear? Was it a cut? Was it a hole?
I can't tell you that. What I saw was the blood coming out of the side of the right hepatic. I put an instrument on, I put a tie around it.
So to quantify the nature of what was bleeding, can you offer me any recollection of what that was?
I don't know how to answer. Do you mean it was a large amount of blood or small or medium?
Let me rephrase. With respect to the artery,
Okay.
can you describe the way the artery was compromised? And I'm not talking about the amount of blood, I'm talking about the amount of how the artery without a bleed would look versus how this artery looked.
It was a very small vessel. It was bleeding. It looked like a vessel. Really, more than likely, an aberrant vessel coming off the right hepatic.
What vessel, please?
Hmm?
A what vessel?
An aberrant. That means that there was the cystic artery, which usually goes to the gallbladder. This was a vessel coming off the right hepatic.
When you were doing this procedure at 5:30, did you have in mind how long it had been after the fall that you said you believe may had caused this bleed? In other words, what time did the fall occur?
From memory, I'm telling you somewhere around 2:30 a.m., 3 hours before we went to surgery.
Is there anything in this description or your observation that reflects or in your mind refers to an injury consistent with one being sustained in a fall?
No, sir, I wasn't thinking of anything like that. I just wanted to get her taken care of.
All right. Do you remember seeing anything within Mrs. Mejia that you concluded was secondary to an injury she sustained when she fell?
No, sir,
Now going to the next paragraph, it says, we left the pack in place and suctioned all blood and debris. What was the debris that you were removing?
the fluid, the avitine, or material that we placed in the first place there, the first surgery, we removed that. We put the suction in the pelvis and removed the fluids and the blood. We then suctioned with the pack in the space between the liver and the transverse colon. We suctioned around that.
So I'm clear, when you're referencing debris, you're referencing
Blood and fluid.
I'm sorry?
Blood and fluid.
Okay. Now, the next paragraph starts, once we went back to the I'm not going to be able to do it today.
Cholecystoduodenal
area, we noted not bleeding. What is it you're referencing there?
Well, we took the pack out of the space between the liver and the transverse colon. This is where the liver bed was. This was where the cholecystoduodenal ligament had been opened and the tissues ligated or tied off. We looked for bleeding. We stood there for a period of time watching. We saw nothing. We then put the Avitine and the gel foam for a pack up against the liver bed, and we put the JP drain in.
How long did you spend looking for bleeding?
Sir, usually what I do is try to stand there for at least 5 minutes. No matter what I have to do, walk around, look, but I always go back to make sure that there's no bleeding.
Anything else?
I may turn around and suction out the pelvis before I turn around and look in the space.
And would that be it? Is there anything else?
Yes, sir. I try to leave, like I say, 5-7 minutes, just to make sure there's nothing going on.
Now, when you say we noted, the area we noted not bleeding, were you relying on the nurse, Deborah, to make that assessment, or were you doing it yourself?
No, sir. Both of us were looking. And if they see something, I expect them to open their mouth, but it's my final responsibility, and I saw no bleeding.
Okay. So let me have you turn to the second page. The second paragraph on the second page begins, "The iron intern." You see that paragraph?
Yes, sir.
And I think it's the third sentence within that paragraph. It says, "Careful inspection revealed a small bleeder." You see that?
Yes.
Do you recall anything more? This goes back to what we were just talking about, correct?
Yes, sir.
This is just in a little bit more detail, correct?
Yes, sir.
Do you recall anything more now, reading that, about the condition of the right hepatic artery or
sir.
the bleeder?
No, sir.
It says, "We placed a clip across it also." Then it says, "There was another area of bleeding." Where was that?
Coming off the right hepatic.
Where was that in proximity to the small bleeder that you noted to begin with?
I can't tell you, sir. I want to say it was off the right hepatic. That's all I can basically tell you.
You have any recollection that isn't reflected here that gives us more idea of what this other area of bleeding was?
No, sir.
There's a reference going down 2 more paragraphs to the use of gel foam and Avitine.
Yes.
You see that? Why did you select to use that?
In the past, I have placed gel foam and Avitine, which are thought to help control any weeping from the liver bed, and these were placed.
Did you take any steps to do anything more to control any kind of bleeding?
We cauterized the liver bed at the time of the surgery, if I'm not mistaken.
Did you, as a result of this procedure, feel that you had secured or closed all sources of bleeding within her abdomen?
Yes, sir, I did.
Do you see anything that, looking at her internally, led you to conclude that she might be at risk for continued bleeding?
No, sir.
Any underlying medical process, physical process, disease process that you thought placed her at a risk for continued bleeding?
No, sir.
Any blood condition, any other kind of physical condition that you think made her at a risk for continued bleeding
At that time, no, sir.
at any time?
Up until I was taken off the case, I felt comfortable.
Do you, sitting here today, have some opinion that some other condition, physical, blood-related, heart-related, organ-related, skin-related, artery-related, whatever it might be, would make Mrs. Mejia susceptible for additional bleeding?
Her diabetic state, you know, they always say healing is difficult. The fact of her being slightly overweight, the fact of a bleeding diathesis or coagulopathy occurring later, but at the time that I was taking care of her, I felt comfortable. I thought everything would go along pretty good.
Now, have you reviewed any of the records outside of the peer review? Have you reviewed any of the records that reflect the surgery later performed on Mrs. Mejia at Baylor?
No, sir, I had not.
Outside of what your lawyers said or in the context of the peer review, were you aware of any findings they made about the condition or the cause of the bleeding she continued to suffer?
No, sir. There was no peer review.
All right, and I'm trying to ask so I don't invade a privilege and
No.
make Russ's jobs easier, so I apologize. I appreciate
No,
what
I
you're
just
saying.
didn't want you thinking that I was given more than what I really received.
Okay. What I'm going towards, doctor, is it's my understanding that there's a later procedure on her at another hospital outside UGH. I wanted to find out if you were aware of what those doctors found was the source of her bleeding.
Mr. Thornton?
No, don't tell him anything I've told you.
Oh.
So don't.
No, sir.
Okay, and that's why I've been asking with the caveat of if it was in the course
I'm
of...
sorry. I just,
No, you're doing fine.
you know, I want to do right by you.
You're doing fine, sir, and it's the dance that we have to do to make sure the record is correct and protecting various privileges, so you're doing nothing wrong. And it's also my inartful way of asking things, so I apologize. I'll tell you, doctor, that it's my understanding that at Baylor, she underwent an emergency surgery and they found bleeding of the right hepatic artery. If that was the case, could you offer any explanation for how they would find Mrs. Mejia in that condition?
Objection form.
No, sir.
If you got all of the bleeding arteries in the right hepatic for Mrs. Mejia during this procedure reflected on the 3 o'clock time frame on the 27th, do you have any opinion why she might continue to have bleeding from that same area the following day?
Form.
Sepsis causing a coagulopathy.
Okay, and what's your basis for that?
Going back to my chart, Dr. Shree had done the lactic acid and I forget what other tests she had done, and those were normal that Friday. But she was looking to sepsis, as was Dr. Kopman. The fibrinogen was slightly decreased after I was off the case and it returned. The PTT was slightly increased after I was off the case and returned to the chart. That to me would start to indicate an infection.
Now, is this something you think that Dr. Shree would not have recognized?
Objection form.
No, she would have recognized.
Do you feel any steps were taken to address that type of concern?
At University General, no. But I don't know what the conversations were.
What steps would you have expected to have been taken to address that kind of condition at University General?
Where she started to see that, I would have thought she might. And I am, this really isn't fair to her, because I'm trying to think for her. And, you know, she may have given fresh frozen plasma. She may have given fibrinogen, you know, she may have given fresh frozen plasma and platelets, but that would have been hers and Dr. Kopman's call. I don't know. And that's not fair for me to try and answer.
Okay. Now, when you did the discharge summary, I guess Exhibit 3, did you make any effort to review the medical records after you were discharged from, or your privileges were revoked from the hospital, to see what care had been given to her?
No, sir, not until I was going further.
Okay, this was 22 days after the...
No, sir, I did not.
All right. And my question is, when you drafted the discharge summary, it was 22 days after the care involved.
Yes, sir.
Did you look at anything to refresh your recollection of what was done 22 days earlier in preparing Exhibit 3?
Not that I remember, sir, or I don't recall.
Were you aware when you drafted the discharge summary that Mrs. Mejia had died?
By that time, yes, sir.
Who told you she had died?
Sir, I don't remember that.
When did you learn she had died?
Probably the 1st or 2nd of July.
And how is it that came to your attention on the 1st or 2nd of July?
I may have spoken to the lady who was in charge of ICU, Cherie Barr Taylor.
What do you call about that?
I don't remember.
Were you surprised when you learned she had died?
Well, they had told me what had occurred, or some of it, and I didn't have much hope of a good result.
So, again, is this the Cherie Barlateri?
No, Cherie, C-H-E-R-I, Barr, B-A-R-R, Taylor, T-A-Y-L-O-R.
Sorry. Take my notes quickly. So, is this what you're just relating to me? Is this something that came from Cherie?
Yes, as I know, sir, as I know.
Okay. And what is it Cherie, as you know, told you about what had occurred?
That she had passed away.
Did she tell you anything more about the course of care Mrs. Mejia received while still at University General?
Not that I remember, sir.
Did she tell you anything about Dr. Hamilton's role, or lack thereof, in the care of Mrs. Mejia?
No, sir.
Did she tell you about any other doctor's actions during the continued course of care after your privileges were revoked?
No, sir.
And did she tell you anything about where Mrs. Mejia had gone after University General Hospital?
Well, I believe she told me she was transferred to Baylor.
Did she tell you anything about why she was transferred to Baylor?
Because they felt she was bleeding.
Did she indicate who felt she was bleeding?
No, sir.
Did she relate to you any other descriptions of the care Mrs. Mejia received after your privileges were revoked?
Not really, sir.
Now, you've told me about your conversation with Dr. Hamilton on the 27th about Mrs. Mejia. Did you ever talk with Dr. Hamilton about this colonic injury patient?
I believe Dr. Hamilton called me on Monday the 30th or July 1st. And I reiterated that case to her, what was happening, and left it at that.
And when you say you reiterated, what does that mean?
I told her what had gone on.
The history of the care of the patient?
Yes, sir.
Did she report to you anything about the condition of that patient at that time?
No, sir, that I remember. I do not remember her telling me anything.
Did Dr. Hamilton relate to you on this occasion, on the '30th or the 1st of July, anything about Mrs. Mejia to you?
I don't remember, sir.
Did she, Dr. Hamilton, tell you anything about efforts to revoke her privileges at the hospital?
No, sir, I never heard that until you told me.
Let me show you Exhibit 10. And that's the only copy I have. But it's my understanding from Monday that this is an email Dr. Hamilton sent on the 1st of July, as the
Can you
first
get a
one.
copy
Here
of
we go.
this?
Towards the bottom, regarding her privileges being at risk because of Dr. Sade. Do you recall if you did talk to her on the 1st or the 30th of June or the 1st of July, being under any impression that Dr. Hamilton's ability to see the patient, the colonic injury patient that you still had at UGH, was in jeopardy in any way, shape, or form?
Say that again.
Sure.
I'm
Here's what I'm trying to
making a
figure out.
mistake.
Okay. The colonic injury patient, do you feel like you talked to Dr. Hamilton at some other time than the 1st or the 30th of June or the 1st of July?
No, sir, I think it was around those dates.
All right. So on those dates, would that colonic injury patient have been the only patient you had left at UGH?
Yes, sir.
When you had the conversation with Dr. Hamilton on the 30th or the 1st of July, I've shown you Exhibit 10, it appears, based on what she testified on Monday and what was reflected in Exhibit 10, that at that point, there had been a threat made to her or implied to her that she was going to lose her privileges at the hospital, kind of like you had a couple days before. Did she relate any of that to you?
No, no, sir.
It says here in Exhibit 10, first sentence, or second sentence of the first paragraph at the bottom, I do not take this lightly and do have concerns that I am at risk for losing privileges, whether temporary or not, based on things that are not accurate. Did Dr. Hamilton ever express any concerns to you about the fact that her privileges at UGH might be at risk?
No, sir.
Other than this conversation with Dr. Hamilton on the 1st or the 30th about the colonic injury patient, did you have any further communication with her about that patient or any other patient from that point forward?
No, sir.
what was the last interaction, if any, you had with the colonic injury patient?
Friday, the 27th.
And did you have any other procedures planned at UGH coming forward into that July 1st timeframe?
At this time, no, but I can't be sure. That's something I did not review.
Do you have any recollection of having to cancel patients or reroute patients to other procedures?
I had to, as I can recall, reroute 2 or 3.
To where did you reroute those patients?
Depending on what the problem was, I would have sent them to Dr. Silver, were it gallbladder or breast or minor surgeries. I would have sent hernias to, I can't remember his name, gentleman out in Duncanville, Calhoun, Dr. Ron Calhoun. I would have sent to him. Other than that, I can't tell you.
Did you have any materials, files, personal belongings, equipment inside the UGH facility that you had to retrieve after your privileges were revoked?
I never went back to try and get them.
How did that, were those materials returned to you?
No,
Do you know what happened to them?
no.
Do you know what kind of materials we're talking about?
I had one of the classic TA-90s from U.S. Surgical, plus a couple of the metal instruments that I purchased so that I could do bowel resections. Subsequent to that time, those materials all became plastic, and they didn't even make the inserts for them anymore. When I was doing a lot of vagotomies, I had a special retractor attached that you would attach to the table to hold the diaphragm up to get to the vagus nerves. I have my own laparoscope, cystoscope, and resectoscope that I had retrieved in 2013, and they're in my office. But that's all I can think of.
Okay. With respect to the procedure laparoscopic cholecystectomy, can you give me an estimate of how many of those you'd performed?
I think I did an evaluation, and it was between 165 and 175 cases per year.
And within the calendar June of 2014, do you recall, other than the colonic injury patient and Mrs. Mejia, performing any other laparoscopic cholecystectomies?
No, I did not check my log to be able to give you that.
Would all of the laparoscopic cholecystectomies that you did in calendar 2014 have been done at UGH?
As far as I can tell, sir, yes.
Would all of them been reflected on this log that you referenced earlier?
Yes.
Is there a specific notation you use for that type of procedure in that log?
I don't understand your question.
Having not seen the log, my question is this. If I go through it and look at it, is there something in particular I should look for to identify a laparoscopic cholecystectomy?
No, over on the side it'll say laparoscopic
All right.
cholecystectomy.
I wasn't sure if there was a code or a shorthand you used. There isn't anything
I'm
like
not that sharp.
Okay. Where did you train to perform laparoscopic cholecystectomies?
I have done laparoscopic procedures from when I began my residency in 1972 through 76. I took a course at Presbyterian Hospital, a 2-day course by Ruddick and his associate, who basically started laparoscopic cholecystectomies in the United States. And this was done sometime around 1990-91.
Between 1990-91 and 2014, did you undergo any kind of additional training to perform laparoscopic cholecystectomies?
I took different laparoscopic programs, but nothing for gallbladder.
Did you use any particular type of technique or method to perform laparoscopic cholecystectomies that's reflected in some kind of training manual that you've used or program that you've
No, sir.
attended? Did you have any kind of physician's agreement, written physician's agreement between yourself and UGH at any time?
No, sir.
Have you ever had an agreement like that between yourself and any other hospital in the course of your career?
Only for a short period of time. Dr. Alex Santos and I covered Renaissance Hospital in Terrell for about 3 years.
Have you ever worked with a group called Palladium?
That is basically an outpatient surgical entity. And I would take day surgeries at times over there. But again, they had to have certain type of insurance. They had to jump through the ringer. And I didn't have patients who could really afford, for the most part, to go through there.
When was the last time you worked with anyone at Palladium?
It's been years, sir. Again, I would have to check with Becky, but it's probably 8 or 9 years.
Now, the Renaissance in Terrell that you're referencing, is that the hospital that was closed? Is that correct?
Yes, sir.
And were you there at the time it was closed by the state?
No, I had left.
Why did you leave Renaissance Terrell?
If I'm not mistaken, they had terminated our contract about 3 or 4 months before, and Alex and I were gone.
And then Renaissance in Dallas, how are you involved with them?
I was an attending physician and surgeon there.
And how did that relationship end?
It became University General, and I continued my relationship.
Who recruited you to continue a relationship with University General?
Objection form.
No one, sir. I had always been at that hospital.
When you were working with University General, did you interact with the CEO at all?
No,
Did you interact with the CFO at all?
no.
Dr. Hamilton on Monday indicated that the CFO had contacted her about reviewing records for Mrs. Mejia. Were you aware of that kind of action being taken by a CFO for the hospital at all, for other doctors?
No.
Can you offer, based on your work with UGH, can you offer any explanation for why the CFO would have been involved in asking a doctor to review records?
Objection form.
No.
Do you know Dr. Shada at all?
I think I've met him 3 times.
When was the last time you would have spoken to him?
That was June 27th.
The conversation revoking your privileges?
Yes, sir.
You'd mentioned that some of his children work for the hospital.
He had one daughter who, if I'm not mistaken, was on that thing. She carries his last name and she worked in medical records. He had another daughter who they made chief nursing officer.
Anyone else, to your knowledge, related to Dr. Shada working at the hospital?
No, sir.
Now, you've been involved in a number of lawsuits over the years, is that correct?
Yes, sir.
Has Mr. Thornton represented you in any of those?
No. No, sir.
Do you have, other than this one, currently any other suits ongoing?
No, sir.
When was the last time you were involved in a suit before this one?
2012, if I'm not mistaken. No, 2009.
How many other cases involved allegations that your surgical technique was below the standard of care?
I can't tell you off the top of my head. There
More
were
than one,
3
though?
or 4. Yes, sir.
Have you ever testified in a trial?
Yes, sir.
How many times have you testified in a trial?
Two.
And were those cases where you were the defendant?
Yes, sir.
Have you ever testified as an expert witness?
No, sir.
Have your medical credentials been subject to board actions?
You'll have to help me a little. Tell me how you mean that.
Well, has the Texas Medical Board ever made findings against you based on your care as a physician?
Yes, sir.
How often has that happened?
Once.
What hospital did that care take place at?
It happened at Renaissance Terrell.
Have you had to testify before the medical board on more than one occasion?
Well, let me, I'm going to object to that. No, I got what you have, I'm sorry.
Yeah, it's going around.
I'll let you ask him about anything medical board related that you got a public record of, but I think my interpretation of the board statute is that unless there's a public record of his testimony, that it's privileged. So for example, I mean, if you've got an order you want to question him about, that's fine. I don't have any problem with that, but in terms of questioning about any kind of hearing before the medical board or any type of testimony that he offered, again, unless there's a public record of that, I'm going to instruct him not to answer.
Well, I think there are public records of it.
Yeah.
I just want to ask him.
And
how
if you
many-
want to show him that, then I don't have any problem, but I don't want him.
No, I don't want to show.
Okay, well, that's fine.
I want you to have a problem. It's Friday. No, I'm just asking. I mean, do you recall you've
Yes,
been called
sir.
before the board on more than one occasion, correct?
Yes, sir.
Okay. And again, not in a capacity of testifying as an expert. It's been related to complaints against you, true?
Yes, sir.
And there's records of those in their on their website and in the public record. You're aware
Yes,
of that
sir.
too. Okay. Have you ever taught medical treatment, care, or any kind of techniques to other doctors or healthcare providers?
Over the years, yes, sir. I have had students from Kirksville College of Osteopathic Medicine. I have had students from Texas College of Osteopathic Medicine.
How long has it been since you taught a medical student?
Those started in 1983 and went through the closing of South Dallas Community Hospital in November of 2003.
Was that another hospital?
That was what became Renaissance, became University General.
Right, it's been through a number of different names over the years.
Over the years, from 1995.
Are you aware of any effort currently to reopen that facility?
Not as I know now, but there are apparently certain people that have notified the bank that they're interested.
Have you been asked by anyone to come back and participate in care at whatever the name becomes for that facility?
It has never reached that point.
Do you have any plan currently to return to performing general surgical medical services?
At this time, I prefer emergency room.
Do you have plans as to how long you will continue practicing medicine?
My faculties are intact, and I would like to practice as long as I'm allowed to.
With respect to you, have you ever been treated for any kind of substance or alcohol abuse?
No,
Have you ever had any medical conditions that affect or impair your ability to perform the medical services?
no,
Are you on any medication currently that would affect your ability to perform medical services?
no,
Are you on any medication currently that would affect your ability to understand and answer the questions as we've been doing here today?
no.
Let's take a 5-minute, and I'm very close to being done.
Okay.
Actually, let's keep going for just a second.
Okay.
I see one thing I need to do. Let me show you Exhibit 11. Been produced to me as a patient ledger associated with your care. I don't know if this is, actually, I think we got this from your lawyer. Do you know what this is?
It looks like a bill from my office.
Can you tell, it's dated the 26th. Can you tell if this is a bill for the laparoscopic cholecystectomy that you performed?
Yes, sir.
Did you issue a bill for any of the care you gave on the 27th, the surgery to correct the bleeding or to address the bleeding?
No, sir.
Is there a reason why?
It was included in the first surgery.
Is this first surgery bill, do you get a lump sum per patient for the procedure?
Yes, sir.
So that if Mrs. Mejia required additional care or had complications, that was all still part of the original lump sum?
Yes, sir.
And who makes that decision? How did that compensation system come into being?
Well, that's what you'd have to talk to the insurance companies about.
Okay. The phone number that's on this ledger, the 214-339, do you know what that number is?
339, where's this at?
It's kind of in the middle.
Oh, that's one of the extensions in my office, if I'm not mistaken.
All right, let's take the
Now the break.
minute break. I am-
Off the record, 2:15 PM. Back on the record at 2:21 PM.
Doctor, you ready to continue?
Yes, sir.
When we talked to Dr. Hamilton earlier this week, she told us that she'd received a call on the 27th from a nurse named Rika Palmer. I think I'm saying it right. There it is. Do you know a nurse named Rika Palmer at UGH?
I think I do.
She testified, Dr. Hamilton rather, testified on Monday that Nurse Palmer had called to warn her about taking on Mrs. Mejia. Were you aware of that?
No, sir.
Do you know how Rika Palmer would have been in any position to comment on Mrs. Mejia's condition or any other doctor becoming involved in her care?
Not that I know of, sir.
Up until the point where your privileges were revoked, did Nurse Palmer, to your knowledge, or Rika Palmer, have any role in the care of Mrs. Mejia that you were involved in?
See, I don't know, sir. I really don't know. I can't tell you.
Do you even know who that individual was? You said you might have.
It could have been a lady who worked in recovery room.
Dr. Hamilton, when we deposed her on Monday, let me get to my notes real quick. When we deposed her on Monday, she talked about conversation she'd had with the OR staff at UGH about the colonic injury patient, the one that we were talking about earlier.
Yes, sir.
To your knowledge, was there discussion amongst the OR staff about the injury that patient sustained? And was that a subject of conversation amongst the staff?
Possibly. I don't know.
Did anyone talk with you about the injury to the colonic injury patient to discuss with you why that happened?
No, sir.
Based on your working at UGH, was the OR staff of the nature where they would gossip about or share this type of information amongst themselves and exclude you from the conversation?
Same objection.
Not that I know of, sir.
Were you aware of the staff talking about other doctors with you, discussing concerns they had about the performance in a particular procedure?
Form.
No, sir.
If Dr. Hamilton testified that this type of conversation occurred with her, can you offer me any explanation for why that might have happened?
No, sir.
Do you remember who the OR director was at the time?
I can picture her. She was a red-headed lady who is now at a Crescent hospital.
Is that the same Crescent you were telling me about
Yes,
earlier?
sir.
And there was a front OR nurse that Dr. Hamilton described as also being at Crescent, who might have also been a scheduler. Do you remember who that was?
No.
Do you remember who the PACU coordinator would have been at the time?
It could have been Rika Palmer, but I don't know for sure, sir.
And the redheaded individual at Crescent, do you have any recollection of her name? Did I ask you that?
No, I can't remember it, sir.
Is there anyone you still maintain contact with at Crescent that you think would know that answer?
No, sir.
I'm assuming, do you know, let me not assume, do you know anything about the bylaws that were in place for UGH pertaining to medical services by doctors like yourself at the time? And
I can't remember anything, sir.
do you recall ever seeing them?
I had a set of the bylaws in my office.
In talking with Dr. Hamilton, did she ever indicate to you that she felt that Mrs. Mejia should be transferred out of UGH?
No, sir.
Did she ever say anything to you that led you to believe she felt differently than, strike that badly asked question. Did Dr. Hamilton ever express to you something inconsistent with the opinion that Mrs. Mejia needed to be transferred immediately out of the hospital?
No, sir.
Did she ever say, Dr. Hamilton ever say to you that Mrs. Mejia should be kept at UGH hospital?
Should be what?
Kept. Retained
She
at
never
UGH.
made a statement either or.
Okay. Her partner, Dr. Alexander, did you know who that was?
I never, that I remember, ever met him. I saw him at a distance.
Did you ever have any discussions with him, either over the phone or in person or through letters or emails or texts about Mrs. Mejia
No,
or about your being removed from the hospital?
no.
Have you ever communicated at all with the CEO of UGH, Mr. Schutz?
No, sir.
Did Dr. Shada ever treat you as if he was a bully or try to bully you into something?
Sir, it's been a long time, but I don't think so.
Doctor, other than the two things I think you've told me, one is that Mrs. Mejia could have sustained an injury when she fell striking the toilet. The other is that something could have been hit during the course of the laparoscopic procedure, causing a bleed of the hepatic artery. Are there any other options you believe that caused the bleed that you corrected on the 27th?
Objection form.
You'll have to state that again because you said something that you hit with the, I didn't hit anything or.
Well, let me rephrase. Are there any, in your mind, are there any other explanations for why Mrs. Mejia was bleeding on the 27th in the morning other than a complication from the laparoscopic procedure or the fall striking the toilet? Are there any other conditions or situations or incidents that you believe could have caused that bleed?
I think the fall caused the bleed.
I understand that. I was trying to identify the population of potential causes. I thought earlier you told me one potential cause would have been an injury during the laparoscopic procedure.
I don't think I said that. I don't want you to think that I caused a problem with the scope or the instruments. I do not feel I did. I feel the bleed was due to the fall.
All right. And I appreciate your position, and I'm not trying to fuss with you, but I thought we had earlier identified that the injury to the artery was a known potential outcome if a laparoscopic procedure was not done with care. Did we not talk about that earlier?
Yes, sir.
Okay. Now, you don't believe you did that, correct?
No, sir.
But you recognize that's a potential, possible, within reasonable medical probability cause of the bleed you discovered on the 27th. True?
Form.
The possibility exists, but I do not think it occurred in this instance.
And I understand that. I'm trying to establish a group of potential causes. One potential cause you've told me about is the fall where Mrs. Mejia strikes the toilet, correct?
Yes.
We've talked about everything that you have that supports that potential cause, correct?
Yes, sir.
You told me that's your best guess. You don't really
Yes,
have
sir.
any concrete evidence to support that, true?
Yes, sir.
Okay. The next potential that we talked about was in the course of laparoscopic. Earlier in the day, I talked with you that you recognized that the operation of the surgical equipment during the course of the laparoscopic cholecystectomy could be a cause of the bleeding. You told me that earlier, true?
Yes, sir.
You recognize that's a possibility, true?
Yes, sir.
Have you talked with me now about all the reasons why you feel that did not happen?
I took,
Okay. And what I'm trying to make sure is in my outline that I've heard from you all the reasons why you think that particular cause, that your manipulation of the surgical instruments during the laparoscopic cholecystectomy did not cause the bleed. Have we done that now?
yes, sir.
Are there any observations or records or test results or findings that you've seen in your review of the records preparing for today that supports in your mind the statement that a action taken during the underlying laparoscopic cholecystectomy caused this bleed?
Do I think? No, I do not.
Right. And what I'm trying to make sure is, are there any test results, observations, recordings, pictures, subsequent findings, comments by doctors or nurses or family members that you think demonstrate that an injury during the course of the underlying laparoscopic cholecystectomy was the cause of the bleed?
No.
All right. Are there any other, we have these two, the fall, we have the laparoscopic procedure being the potential causes. Are there any other causes you believe, based on a reasonable medical probability, could explain why Mrs. Mejia was bleeding on the morning of the 27th that we haven't talked about?
No, sir.
All right. Doctor, those are the questions I have for you, and pass the witness.
Can I have the mic? This one's on?
There you go.
Dr. Bianco, there's just a couple of matters I'd like to talk with you about, okay?
Yes, sir.
On the 25th of June of last year is when Ms. Mejia presented to UGH, right? Yes?
Yes, sir.
Do you know of any other doctors involved in her care at the hospital before the 27th when you took her back to surgery?
No, sir.
Were you the only doctor involved in her care before?
Dr. Richard Andrews did an internal medicine consult. And that was it. Now, a different set of internists was written for, but apparently they were out of town, and so he came and did it.
What do you mean by a different set of internists was written
I
for?
had written for Dr. Gamil and Doty. And Dr. Richard Andrews was covering them, and he came and did the consult pre-op.
And what was the purpose of having him consult?
Because I wanted to make sure that everything was going along. I wanted someone else to see her. From an internal medicine standpoint, since she was a diabetic,
You would be handling surgical issues, and you believed that she needed somebody to do a review of her medical issues.
that's correct.
Earlier, there was testimony with regard to your recollection of communicating with Dr. Hamilton on the afternoon or evening of June 27th. Do you recall that?
Yes, sir.
That testimony, I mean. It's your recollection that most likely that conversation on your end was on a cell phone. Is that right?
As I remember it, sir, yes.
Do you have the same cell phone now that you did then?
Yes, sir.
Can you tell us what the phone number is?
I already gave it 469-644-6492. Do you want my home phone?
I'll get to it in just a second. Let me make sure I got it right. And if it's already been testified to, I do apologize for repeating.
That's fine.
I didn't hear it. 469-644-6492?
Yes, sir.
Okay. And because you believe you were at home, or the way you recall it is that you were at home when you had this communication?
Yes, sir.
All right. Could you share with us your home number? Would you mind doing that?
972-780-5623.
And it's not your recollection that you communicated with Dr. Hamilton while you were at your office, is that right?
No, sir.
That's correct?
Yes, sir.
All right. I think that's all the questions I have for you, Doctor.
Thank you.
I don't have any questions this time.
Two related. Who was your cell phone provider? Do you know?
AT&T.
Oh, I'm sorry. And did you have an alternate doctor at the time, back in June of 2014?
An alternate doctor.
Yeah, the bylaws talk about that each practitioner, actually not the bylaws, the rules say each doctor shall name another member of the staff as an alternate to attend if they weren't available.
When the application was presented, which was, I believe, in 2012 or 13, I believe I listed, though I cannot be sure because I don't think I have a copy. I listed Charles Silver, Alex Santos, and Elliot Bader.
And since you bring it up, did, to your knowledge, Dr. Silver have privileges to admit and see patients independent of assisting you
Right.
at UGA?
I'm sorry. Yes, sir, he did.
And did Dr. Santos have privileges at UGH?
At the time that I listed him, yes. I don't know if he had gone to Austin or when he went.
And how about the same question for Dr. Bader?
Yes, as far as I know, when I listed him, he had those privileges.
Okay. That's what I have for you. Thank you, sir.
Thank you.
That means you're done.
Thank you very much.
Off the record, 2:41 PM.